ADHD isn't just a childhood phase. In the United States, about 6 million kids are diagnosed, and the studies show half to almost 90% of them still have symptoms as adults. Yet, so many people are told, just take a stimulant or try harder. But for many, that's not enough. Or side effects make it impossible to stay on medication. Today, I want to show you a different way to understand ADHD through the 4 pillars of my ACEs model: anatomy, chemistry, energy, and soul. We'll look at what's happening in the brain, what the research says about new therapies, and how whole person care can help when standard tools fall short. First, let's talk honestly about standard care most people know. Stimulant medications like methylphenidate and amphetamines are still the first choice. About 70% of children or 60% of adults respond well, but that leaves a big group, as many as 30 to 50%, who either don't get enough benefits or stop because of side effects. Common side effects include appetite loss, up to 40 to 60%, trouble sleeping, 25 to 40%, faster heart rate or high blood pressure, anxiety or jitteriness, 15 to 25%, and sometimes emotional blunting or irritability, 10 to 15%. The rare but important tics, mood swings, or even psychosis in very sensitive cases. Some people cannot really take them. For example, people with serious heart disease, uncontrolled high blood pressure, certain cardiac arrhythmia, a history of substance misuse that isn't well managed, and interaction with MAO inhibitor antidepressants. Non-stimulant medications like atomoxetine or guanfacine avoid some abuse risk but are less effective and can cause fatigue, GI upset, and in rare cases, liver problems. Therapy and coaching are powerful, but access, cost, and the need for long-term engagement can make them tough to sustain. That's why many people, including me, look for additional ways to support the brain. ACEs stands for anatomy, chemistry, energy, and soul. From an atomic perspective, the structure and the physical health of the brain and the body. Anatomy is about the structure and the physical health of the brain and the body. Chemistry is about the neurotransmitters, nutrients, inflammations, and other biochemical balance. Energy really describes the brain electrical networks and self-regulation. Soul is about a person's identity, purpose, and emotional resilience. When we treat ADHD from only one angle, we miss the big picture. Let's walk through each pillar and what it means in real life. Let's start with anatomy, supporting the physical brain. ADHD brain aren't broken, but some areas develop or work differently. Prefrontal cortex, the brain CEO for focus and planning. Imaging shows delayed maturation by about 2 or 3 years, and a thinner cortex here. Less activity show up on tasks that need sustained attention. Exercise boosts a brain growth chemical called BDNF and improves blood flow. A larger review found moderate improvements in executive skills with regular aerobic activity. Anterior cingulate cortex, or error detector and emotional regulator, often underactive in ADHD. Mindfulness training has been shown on brain scan to increase ACC activity and attention control after just 8 weeks. Basal ganglia, the brain's motivation and reward hubs, can be smaller or have altered dopamine signaling. Consistent sleep and predictable routines help regulate these pathways. Movement boosts dopamine release. Cerebellum, not just for balance, but timing and coordination, often smaller in ADHD patients. Balance training, dance, martial arts can sharpen timing and working memory. Default mode network, the daydream system. In ADHD, it stays too active. Mindfulness and neurofeedback help the brain switch it off when focus is needed. So sleep, movement, and mindfulness aren't vague lifestyle advice. They literally help these networks work better. Next is chemistry, the molecules that runs the brain. Dopamine and norepinephrine, the key messengers for focus, are often underactive in ADHD. Stimulants boost them directly, but we can also support the system. Omega-3 fatty acids. People with ADHD often have lower levels. Review of dozens of studies shows small but real symptoms improvement, especially with EPA-rich fish oil over 500 milligrams a day. Iron and ferritin. Iron helps make dopamine. Kids with low ferritin have worse symptoms. Studies show iron supplements improve scores if deficiency is corrected. Zinc and magnesium both support dopamine and calm overexcited brain circuits. Small trial shows less hyperactivity and better sleep when these are low and then replaced. Diet and inflammation. Some kids respond when artificial colors or certain trigger foods are removed. Mediterranean-style anti-inflammatory diet and a stable blood sugar help many adults feel less brain fog. Gut health. Early research links gut imbalance to behavior. Probiotics and prebiotics show promise but still need stronger trials. As a clinician, I check labs, ferritin, zinc, magnesium, omega-3 index, vitamin D, methylation, balance, zinc cup, and free cup load, and correct what is low or abnormal. It is not alternative. It's targeted chemistry support that can make brain more responsive to therapy and medication. Energy is about the brain electrical circuits and self-regulation. Real-time EEG training teaches the brain to move from slow, unfocused rhythm toward alert, stable ones. Review shows medium improvements in attention and hyperactivity, and some people stay better months later. It is slow and requires 30 to 40 sessions of neurobiofeedback, but it's safe and empowering. Transcranial direct current stimulation, which is a gentle, low-intensity current through scalp pads, make neurons slightly more or less excitable. Some small studies show better impulse control and working memory, but a big trial have mixed results. It's inexpensive and well tolerated, mostly mild tingling or itching. Quick comparison with TMS. tDCS is gentle and shallow, like nudging the brain. TMS, on the other hand, is stronger and more focused. It uses magnetic pulses to make neuron fire. TMS is FDA approved for depression and OCD, but not yet for ADHD, though early studies show moderate short-term improvement in attention and executive function. It's clinic-based, more expensive, and can cause scalp discomfort or rare seizure, less 1 in 1,000 for people who have pre-existing seizure problems. So, tDCS is a low risk and subtle. TMS is more potent, but still research level for ADHD. However, if we use QEEG-guided TMS, that's going to be a totally different story because it will really target the area of abnormality and regulates them gently and modulate them to the balance. The mindfulness and MBCT, structured attention training with CBT elements, research shows moderate improvements in focus and emotional regulation with almost no risk. It also helps calm the default mode network. Clinically, I often combine lifestyle and nutrition first, then consider neurofeedback as a base and tDCS or TMS only when needed, and recommend mindfulness to almost everyone. Finally, soul. How we see ourselves and find purpose. ADHD often leaves a trail of shame, being called lazy, careless, or not living up to your potential. There is even a term, rejection sensitivity dysphoria, describing the intense pain they feel when criticized or when they fail. It's biologically wired and can feel depression and anxiety. Healing here means rewriting the story. ADHD is a difference, not a defect. Research on acceptance and commitment therapy shows that when people reconnect to their values and purpose, mood improves and functioning follows. Compassion-focused therapy reduces self-criticism and boosts resilience. Spiritual or contemplative practices, whether prayer, meditation, or service, can turn struggle into growth and hope. Studies across chronic illnesses show spiritual well-being improves coping and adherence with therapies. Clinically, I have learned if someone's self-worth is shattered, it's hard to stick with sleep routines, exercise, or neurofeedback. When shame is addressed and the purpose returns, the other pillars, anatomy, chemistry, and energy, suddenly become much more effective. For me and many of my patients, progress came when I stopped chasing one magic fix and worked across all four pillars. Neurofeedback plus targeted nutrients raised the baseline focus. Exercise and sleep rhythm kept those gains. Mindfulness and self-compassion tamed shame and reactivity. No single tool cures ADHD, but together they create stability, hope, and better function. So, start with sleep, exercise, and a healthy daily rhythm. Check and correct nutrients like iron, zinc, copper, magnesium, methylation, and omega-3. Consider neurofeedback for partial responders. tDCS is safe but experimental, TMS stronger but still research level, and QEEG-guided TMS is actually effective and safe. Of course, it's not covered by insurance yet. Add mindfulness or acceptance-based therapy to heal shame and strengthen resilience. Use meds and therapy when helpful. ACEs is about adding dimensions, not replacing proven care. Track progress with simple rating scale every 6 to 8 weeks. In conclusion, ADHD isn't just a chemical imbalance, it's a whole person condition. Looking at anatomy, chemistry, energy, and soul, let us combine the best of medicine with lifestyle, neuromodulation, and meaning-centered healing. If you're struggling or treating someone who is, remember, there are multiple levers to pull. I'm Dr. J.D. Young. Thank you for listening to the ACEs Health Podcast, where ancient wisdom meets modern science to help us all heal more completely. Stay focused, stay healthy. We'll see you in our next episode.